Welcome back. As part of the World's Diabetes Day commemoration today, the Ministry of Health and Social Services, along with its stakeholders, are to embark on an educational campaign to sensitize patients and communities about the disease. To provide more information, I am joined by Sister Hileni Samuel, Senior Registered Nurse, Diabetes Nurse, Educator, and Advanced Wound Care Specialist at the Windhoek Central Hospital. Very good evening, Sister. Thank you so much for joining us. Good evening. Good evening to the viewers as well. How is the World Diabetes commemoration going thus far?
So far, so good. We had the day launched this morning by our Honorable Deputy Minister, Dr. Esther Munyangwe, and it went well.
Very well. Let's start by trying to educate our viewers on what exactly the two types of diabetes that are there. Can you differentiate between those, please?
Yeah, very, very important. We have type 1 diabetes and type 2 diabetes. Remember, for us to understand what diabetes is, we have an organ in our bodies that is actually a small organ just below our stomach that is responsible then for producing then insulin to lower our sugar levels. Whenever you eat something, automatically the sugar levels goes up, and then this organ is producing then the insulin to lower the levels of sugar in our blood. So what happens now is that in type 1, it's an autoimmune condition whereby the antibodies of the body, the antibody that is protecting the body, identify these beta cells that are producing the insulin as a foreign, and then it destroys then these beta cells, meaning that there's no insulin coming at all to lower their blood sugar levels in the blood. And then in type 1, there's nothing that we can do to prevent it. As I said, it's an autoimmune and also sometimes environmental. Now, in type 2 diabetes, this is now a lifestyle condition with the contributing factors mostly of a sedentary lifestyle where we don't exercise and then we pick up a lot of weight. It's also contributed to some other medications as well that also contribute, and then the food that we are also eating. We have a lot of carbohydrates or a lot of junk food per se, and then we don't really exercise and we pick up a lot of weight. And then this fat is also actually aligning on the pancreas. That pancreas that is now responsible to produce insulin is now covered with fat. And then the insulin is coming in less or it's not coming at all, making it resistant then. And then there's no enough insulin to bring then our sugar levels down.
Very well. And the Minister officially launched the commemoration of the World Diabetes Day today. How did the launch go, and maybe what can you share about what happens today?
Okay, yes, today, very, very important. We launched the day to commemorate the day in creating awareness and also to sensitize the community that diabetes is real. And also, we have also seen from our statistics that diabetes is on the increase. And diabetes is also one of the non-communicable diseases, actually, that is also causing death among the population. And just to give you a brief overview as well, we have 43% of the population that are dying from non-communicable diseases, hypertension, the cancers, the strokes, and diabetes included. Okay. And we also see today with the statistic that we revealed today as well from Commerce region, we have around about 10,838 people that are living with diabetes. This is now only in the eight clinics that we took the statistic from, which is an alarming number as well. So our aim is actually just to educate and to sensitize, and also to educate on the lifestyle, to change our lifestyle in order to fight diabetes occurring.
All right. I understand that part of the commemoration is also to provide free tests for those who would like to find out about the level of sugars that they have or level of insulin in their bodies. How important is it to have that part of the commemoration?
Yeah, it's very, very good question, because remember, as I also always saying that most of the time people don't show signs. It's also one of the silent killers, because when people are presenting then with a complication of diabetes, only when they present at the clinic because something happened. So most of the people, they don't feel or they don't see anything. So it's very, very important to go for this free testing. It's free that you can go for any clinic in Commerce region, or also in the regions you can go for the testing on diabetes, and we are also going to test also hypertension, because these two things goes hand in hand, hypertension in diabetes, because it all affects all your blood vessels, and at the end of the day it will end up with damaged blood vessels. You can end up in heart attacks, you can end up with strokes, blindness, and also amputations of your legs and also feet.
Very well. And now, if one finds out that they are tested positive for diabetes, what steps or procedures does the healthcare practitioner, such as yourself, take then for the patient? Be it, because of, it can, of course, have a mental effect and a physical effect, of course, on one's body or one's state. What are the procedures then that the Ministry of Health or health practitioners take after the results have been tested or seen as positive?
Yeah, they're very, very important. We have dedicated staff on the sites. And diabetes, we don't just conclude and say you have diabetes by having the first reading. Even if you have eaten and we see that your reading is higher, we talk to you and then we send you for a retest to come again on another day without eating to go for a retest. And then again, if we still see that we have done the retest and it's still higher, then we do counseling. We give you a proper information and informed or also information on what to do, and then we refer them to the next level, which is now your nearest clinic, or which is now the doctors at the clinics that can actually take up the matter further. And because you can have a higher sugar levels, but not necessarily that you have sugar or you have diabetes. Maybe you have eaten something sweet, or maybe you have any other condition that can also be a contributing factor. So we don't just diagnose there on the spot and say you have diabetes and we put on medication. No, it's a process that you need to follow, and then you need to wake up, and also psychologically we need to prepare also the person also to take up the matter as well.
Very well. And there are 10 free testing sites currently, being undertaken by the ministry for those who would like to, go and get their diabetes levels checked. Where are these sites exactly?
Yeah, we have identified sites, starting with the two big hospitals in the state facilities, the Windhoek Central Hospital on ground floor, and Katutura Hospital as well. And then we have Venil Park opposite Woolworth, and then we have Katutura ShopRite. We are also testing there. And then the other 4 clinics, we have now the Vanaheda Clinic, Ochomise Clinic, Mahulili Clinic, and also then Okuriangava Clinic, and also the last one is the Komasdal Clinic. Any person, or even Robert Mugabe, you can go there. If you are near Robert Mugabe, you can also go and ask for that test. They will be able to test as well. And then the Dongaru Clinic as well, you can also access those clinics which are not mentioned.
Very well. And what are some of the advice that you can give to someone who's going to prepare themselves to come for a test? What do they need to prepare themselves for? What do they need to have on them? And how can they go about it?
Yeah, firstly, we only want your body. Yeah, you need to prepare so that you want to go for the test, and it's very, very important to know our numbers. So if you have your health card passport, you can also take your health passport along. If you don't need to have a headache about it that you don't have, as long as you go there, you will be assisted. And also people that also want a proper reading, they need to have maybe 14 hours without eating. That is, we call the fasting testing. But other than that, just go out there in numbers. Take a neighbor, take a friend, take a relative, share the information. It's very, very important to fight as a nation this diabetes that is really a problematic, not only for the client, but also for society and also for the ministry, because if somebody is diagnosed with hypertension and diabetes, they also need psychological support. They also need a support system from family members as well, to support them all the way and to be with them all the way in their journey of diagnosis. And also as a ministry, we also urge everybody that is on treatment to adhere to the treatment, and also for us to change also our lifestyle in what we are doing, so that we can just change and prevent diabetes.
Sister, thank you so much for making the time to talk to us this evening, and thank you so much for sharing information on, of course, the World Day of World Commemoration Day of World Diabetes Day, and we wish you all the best for the coming events.
Yeah. Thank you very much, and thank you to the viewers.
All right. I was in conversation with Sister Hileni Samuel, who is a senior registered nurse at the Ministry of Health and Social Services. We have more interviews coming up after this break. Don't go away.